Hello, good evening. Welcome to another session. This time we'll be talking about the pathology of fluid imbalances, the coagulation system, and essentially what happens when there is something wrong with either your blood vessels or the fluid within the blood vessels. No. First thing we need to understand when we talk about hemodynamics are the Starling forces. And basically, the Starling forces are the forces at play um, within and immediately outside the vessels. So, there are three major forces acting on the blood vessel. The first is what is known as hydrostatic pressure, or essentially blood pressure. Hydrostatic pressure is the pressure of the fluid on the vessel wall. So essentially, much like if you have a room full of crowded people, and the room has reached its maximum capacity, um, the people towards the sides or the corners of the room will be pushing against the wall. So that force is similar or akin to the force that the fluid inside the blood vessel is exerting on the vessel wall. So that is known as the hydrostatic pressure, and essentially the direction of that pressure is going out. Okay. Now, another um, very important Starling force is the plasma colloid osmotic pressure. Okay? Plasma colloid osmotic pressure. And essentially, this is a pressure that pulls um, fluid within the vessel. It is keeping the fluid within the vessel. And the major player that contributes to this is the major plasma protein, albumin. Okay? Albumin is the most abundant plasma protein. And um, it serves to hold water inside the blood vessels. Okay? So that's plasma colloid osmotic pressure. So, and then finally, we have interstitial fluid pressure, which is the pressure outside the blood vessel wall near the tissue. Okay, so you have fluid bathing the tissues, and it is exerting pressure with it onto the vessel wall. So it is pressure from the outside pushing into the pushing into the blood vessel. Okay, so again, hydrostatic pressure pushes fluid out. Colloid osmotic pressure keeps fluid in. Increased interstitial fluid pressure is pressure from the outside pushing into the blood vessel. Okay? And once you have disruptions in any of these Stirling forces, leading to fluid going out of the blood vessels into the spaces near the tissues or the interstitial spaces, that is a condition known as edema. Okay? Now, generally, you can divide edema into two. You have localized edema and systemic edema. Okay? Localized edema can be due to inflammatory and mechanical causes. Okay? Now, inflammatory, we know that due to the action of cytokines, particularly TNF, interleukin 1, and interleukin 6, this causes retraction of the endothelial lining, okay, or the individual endothelial cells. This causes water to go out or plasma to go out from the blood vessels into the interstitial fluid. Okay, so there, fluid is going to accumulate within the tissue spaces, causing swelling. Okay, so inflammation is an important cause for localized edema. Okay, another cause for localized edema is obstruction, and we typically see this in parasitic infections, in the lymphatics, particularly filariasis, caused by um, a small worm, a bloodworm, okay, Wuchereria bancrofti, um, and Brugia malayi, okay. Um, Cancer cells can also block um, passage of lymph fluid out of the lymph nodes, causing edema. Okay. The lymphatics are also very sensitive to radiation and medications, and if they are exposed to very strong radiation or very strong medications, um, the lymphatics may become fibrotic, okay, and this will cause mechanical obstruction. In fact, if you have if there is a woman who has had a history of breast cancer, and of course what they do is they take the patient undergoes a procedure. The standard method of treatment for breast cancer nowadays is modified radical mastectomy. Essentially, you take out the breast and the axillary fat, okay, fat sa kilikili, together with the regional lymph nodes, the lymph nodes in the kilikili, okay? So if you take out the lymph nodes, what's going to happen is there's going to be increased pressure in the axillary area, because there's nothing filtering out the lymph fluid there. Okay, so it's in a chronic state. That area usually becomes congested with lymphatic fluid, and that is actually the one of the common complaints of women who have had modified radical mastectomy. There's a feeling of fullness near the armpits. That's actually the feeling of lymphatic fluid accumulating, because there's no lymph nodes there. It has the lymph nodes have already been taken out. Okay. Now, over time, chronic congestion of the lymphatics, or chronic blood obstruction to the lymphatics because there's no lymph nodes in the axillary area, will actually predispose a person who has had breast cancer before and who has undergone treatment to another type of malignancy, in this case angiosarcoma. Okay, and that angiosarcoma is due to chronic lymphedema. Okay, and you call this condition wherein you develop angiosarcoma, or a malignant tumor of the blood vessels that arose due to either post-mastectomy or medications or radiations. You call that Stewart-Treves syndrome. Stewart-Treves syndrome. Okay, so these are examples of localized edema. In some cases, edema may be systemic. Okay, it may involve the entire body, and a systemic edema is known as anasarca. Systemic edema is known as anasarca. Now, this is where the Starling forces come in. Okay, so when you have increased hydrostatic pressure, and you see this in most of the prime example for this is congestive heart failure. So the heart is not able to pump correctly, because we know that one of the compensatory effects of the heart when it is exposed to increased blood pressure for a long time is it becomes larger. Okay, the ventricles become thicker. Okay, that's part of cellular adaptation. It undergoes hypertrophy. Okay, however, as we've mentioned in one of our previous lectures, the hypertrophy causes ventricular remodeling. There will be a change in the shape of the heart. Much of the contractility of the heart is because of its pyramidal shape. Okay, it's an inverse pyramid. That's why it can contract the way it does. Now, if the heart muscles undergo remodeling, it assumes a globular shape, and as a result, the heart cannot pump properly. Okay? Now, over time, this results into a condition known as congestive heart failure. Now, congestive heart failure, the heart is big, it has undergone remodeling, it cannot pump very well. As a result, blood backs up from the vena cava and other parts of the body, because the heart cannot pump very well, so magpundo siya. Okay, and as a result, in the areas of the body where blood is backing up, there is increased hydrostatic pressure, causing plasma to leak out. Okay, that's increased hydrostatic pressure. Another cause for systemic edema is when you have a loss of albumin, and this can either be due to failure of the liver to produce albumin, okay, particularly in malnutrition, okay, and in nephrotic syndrome, wherein your kidney is losing out albumin into the urine, okay. Acute retention of sodium can also cause systemic edema. So, the next few slides are essentially the specific mechanisms by which reduced oncotic pressure can lead to systemic edema. This is the mechanism that I mentioned earlier, by which congestive heart failure can lead to edema. Okay. So essentially, depending on what side of the heart is affected, it's going to affect that part of the circulation. So for example, in right-sided heart pressure, or right-sided heart failure, the right atrial pressure increases, systemic venous pressure increases, and congestion occurs in the lungs. Okay, and this is the reason why in right-sided heart failure, the patient will present with dyspnea or difficulty in in right-sided heart failure, the right atrial pressure increases, the systemic venous pressure increases, and congestion occurs in the systemic circulation, because since it's the right side of the heart that cannot pump. Remember that the blood goes through the right atrium, diba? So mag-back up siya sa right atrium because the right side of the heart cannot pump. So as a result, blood backs up to the systemic circulation, leading to edema of the lower extremities and backing up of blood to the liver, causing congestion of the liver. Now, prolonged congestion of the liver can cause a nutmeg appearance, and this is known as chronic passive congestion of the liver. Okay, if blood backs up in the systemic circulation, okay, so we know that the majority of the blood passes through the liver at any given time. If there is a failure of the right side of the heart, so the blood cannot circulate in the systemic circulation, and as a result, blood backs up into the liver. The problem with having blood back up in a particular organ is there is no new supply of oxygen flowing through. So as a result, it's going to it's going to cause ischemia in the deeper zones of the liver where oxygen does not is not delivered as easily, and this gives the characteristic nutmeg appearance of central passive congestion of the liver. Now, what if there is edema on the left side? What if there is failure of the left side of the heart? So we know that from the lungs, the blood goes to the left atrium, and then it goes down to the left ventricle, and then it goes to the systemic circulation through the aorta. Okay, so in left-sided heart failure, what's going to happen is left atrial pressure increases because blood is backing up. The left ventricle cannot pump. Pulmonary venous pressure increases, and as a result, blood backs up into the lungs. So this will lead to pulmonary edema. Okay. There is no initial change in the right atrial pressure just yet. Okay. Here is a picture of pulmonary edema. So you have the alveoli, but if you look at the insides of the alveoli, there are actually this pinkish fluid. This is actually edema fluid. Okay. In chronic pulmonary congestion, again you have the alveoli, you have some degree of inflammation, but you also have this pink proteinaceous fluid. Okay. Now, this brown material here is actually composed of hemosiderin, which is the breakdown product of hemoglobin. Okay, so because blood stays in the circulation, in that part of the circulation for a longer period of time, hemoglobin is going to be broken down. Now, some of these hemosiderin molecules are eaten up by macrophages. Okay, and they become filled with hemosiderin, and These macrophages that gobble up hemosiderin are known as heart failure cells. Okay? Now, hemorrhage or bleeding can occur in different forms, and depending on what form they take, they actually reflect different types of pathologies. Okay, so in the skin, mucous membranes or the serosal surfaces, bleeding that are small, less 1 to 2 millimeters in diameter, are known as PTK. Those that are medium sized are known as purpura, and larger hemorrhages into soft tissue is known as ecchymosis. Okay, so that's when bleeding occurs in the skin, mucous membranes, or serosal surfaces. However, when bleeding occurs in a particular cavity of the body, we also give it different names. So you have hemothorax. Okay, if it occurs in the thorax, hemoperitoneum, of course, in the peritoneum, hemopericardium if it's in the pericardium, and hemarthrosis if it occurs in the joints. Now, hemostasis is the sequence of events following vascular injury that results in the formation of a clot. Okay? And the second part of hemostasis is dissolution of that clot when it is no longer needed. So hemostasis is a balance between the formation and dissolution of a clot. And the key regulators are endothelial cells and platelets. Okay? Hemostasis is divided into primary and secondary hemostasis. Primary hemostasis is the first event wherein the major players, as mentioned, are endothelial cells and platelets. And the end product of primary hemostasis is the primary platelet plug. Okay? Now, over time, to ensure stability of the platelet plug, that platelet plug is reinforced by several proteins that are activated in a cascade known as the coagulation cascade. The reinforcement of the platelet plug by these coagulation proteins or coagulation factors forms a stronger plug known as the fibrin clot. Okay, and that is the end product of secondary hemostasis. Okay. Now, platelets are blood cells, although technically they are not true cells. Okay, platelets are not true cells because they are just fragments of the cytoplasm of a larger precursor cell in the bone marrow known as a megakaryocyte. Okay? Platelets last for about 10 days in circulation, and they appear as small biconvex discs. Okay? When platelets become activated, they begin to assume a spherical shape. Okay? Now, the main function of platelets is they form the primary plug to try to stop the bleeding. Okay? And this is what it looks like under the electron microscope. These are the different parts of the platelet. You have the microtubular bundle, which maintains the shape, actin and myosin, which, as we all know, are involved in contraction, and the usual organelles. Okay. Now, it is important to note that the platelets the platelets have a specialized endoplasmic reticulum, which is where calcium is sequestrated, and this is known as the dense tubular system. Okay. Now, when a blood vessel wall, it is important to note that when there is when there is